Hello, good evening, everybody. So today's topic is headache. Now, what is headache? Headache is a pain around the head. It may be anywhere, maybe in front or sides or behind or whole head. In life, everybody has suffered headache at least once in their lifetime. Now, we should know what are the causes of headache. Now, if you know the causes of headache, then you can give the proper treatment. Most common cause of headache is because of sinusitis. Whenever the cold is very common, off and on, people have cold. So in that case, whenever there is a sinusitis, that means inflammation of the sinus, that can lead to headache. Depends upon what type of sinus is involved, you get the headache, like frontal sinus or maxillary sinus, ethmoidal. Depends upon that. Usually, the person has headache, and there is always a history of cold. And one more condition known as hypertension, high blood pressure, also can lead to headache. In this headache, usually the headache is continuous, it's a dull, and if very high blood pressure, patient can have vomiting also. One more condition known as a migraine. Here also, usually the half type of headache, but nowadays even full headache also can occur. Usually there is a nausea, sometimes vomiting. There are visual changes also. There scintillating type of lightning seen by some patients, and definitely migraine is related to the anxiety and tension. Lack of sleep, lots of worries also can lead to this type of migraine. One more condition very common nowadays is cervical spondylitis, and this can occur because of your computer job, where all the time you're working and your head is little front, and your position of the head is little front. Because of that, also there is a cervical spondylitis can lead to headache. Here, the headache is starts from the neck, and there is a usually a in severe type of cervical spondylitis. There is a tingling numbness of the hands also, and localized headache, especially in the temporomandibular joint. Also, if there's inflammation, also can lead to headache. And most common cause also is the eye problem. Wherever there is a any condition in the eye, like reflective error or in many other conditions, also can lead to headache along with your pain in the eyes also. So these are most common conditions of your headache. Now, out of this, today we are going to talk about headache due to eye problems. Now, how to find out whether this is because of eye problems? Very important is the history. In the history, when you ask about all different types of questions, you will come to know that this is headache is because of eye problems. Of course, you are going to ask about history of hypertension, history of diabetes, history of wearing glasses, when did you change the glasses, history of cold, your job, whether it's a computer related, or there's some nausea, vomiting also can tell you about your headache cause, maybe migraine also or hypertension. So these are all history taking is very important. In case of eye problems, you have to ask is whether your headache or pain in the eyes, usually whether it is increased in the evening because whole day you are using your eyes and because of that there is a eye strain and there is a headache. And whether there is any change of glasses or after using your eyes, if you have headache, definitely it is related with the eye problem or change of glasses. So in case of refractive error, that means there is a change of number or because of number, if the patient doesn't have any glasses, because of that also patient can have headache. In this case, there are different types of refractive error. I think we should not go into detail about all this refractive error, but going to eye specialist to find out any refractive error is there or not is very important. And glasses, whatever doctor says, you have to wear the glasses and see whether your headache is reduced or not. If not reduced, you have to follow with the doctor. One more condition where if you're using your eyes for a longer time, you're reading for a longer time, or especially in the dim light, if you're reading, driving, all these conditions, and especially excess use of devices like computer, phone, screen time, if it is increased, all this also can lead to headache, because it's like when you run for a longer time, your legs pain. Similarly, the eyes also pain and there's a headache. So this is regarding your other things. Your eyes are normal, but because of much use of your eyes. One more condition known as a glaucoma, where your intraocular pressure of the eyes are increased. In this condition, also you can have headache and pain in eyes. Uh, in this type also, there are various types of glaucoma also can lead to headache and pain in the eyes. For this, you have to go to a specialist to find out whether there is any high pressure in the eye. So this is important. In case of papilledema, that is intracranial pressure, if it is increased, in this case also you have to severe headache and severe nausea, vomiting. You have to go to neurologist or physician to find out whether there is any intracranial problem. For that, certain investigations like MRI, you have to go for and find out whether there is any ICT increased or any other reason for your headache. This is an emergency. Papilledema is an emergency. Proper investigations are very important in case of headache. And whatever a physician says, you have to go for it. Very important. If the cause is not found out, then of course lifestyle changes are there. Even for all other causes, like tension, headache, migraine, all this is very important. Where you have to change your lifestyle and your calming of your mind by doing meditation and pranayam. All this you have to do. Less of worries. All this is very important. Along with that, you can go for other medicine like homeopathy medicine. You can go for it and see how your headache reduces. Because most common cause of your headache is worries, which can be reduced only by lifestyle changes and homeopathy medicine. Thank you very much.
वीडियो नहीं खुल रहा है.
So just a minute.
अरे कुछ नहीं, ये जो स्टार्ट वीडियो किया तो ऐसा. अच्छा होस्ट. Okay. All right. So I hope all of you are doing well, and we are talking about homeopathy in headaches and migraines due to eye problems. And homeopathy world over is known for migraines and headaches. And one of the commonest problems of migraines and headache is related to eye related issues. So just like in every case in homeopathy, there is no specific medicine, but the idea of individualization is the main thing, where in homeopathy we try to go at a deeper level. We try to understand the person in the disease, the man in the disease, as Master Kent would say it. And after understanding the entire case, after a deep case taking that a homeopath does, finds a remedy for the person, understanding his chief complaint, his state of mind, his past history, his family history, his genetic history, his fears, his crisis moments, and the experience in the crisis moment. All these would be so important for us. Having said that, there are certain homeopathic remedies which have a specific action on eye-related issues. One of, and there are so many medicine, we can go on for many hours, but I'm going to tell you a few of the remedies which I use a lot in my practice. I'm going to share the screen. Okay. Here we go. One of the main remedies that I often use is the remedy onosmodium. It is said, and onosmodium, you have to read it from the Materia Medica of Clark. Very beautiful. And you know that the more I'm reading Clark, the more your understanding of homeopathy will go at a deeper level. So I'm going to read it up for you. He writes, Clark, feeling of tension in the eyes as from straining them to read small print, desire to have things far off to look at them. It shows a paralyzing effect on internal eye muscles and gives one of the main things for this remedy. Then Clark writes the most important line, and I want you to remember, onosmodium has probably cured more cases of headache associated with eye strain than any other remedy since it was proved. You can understand it's such an underrated homeopathic remedies. And you know that there are many remedies for headache due to eye. You know, you can start from Natromure, you can go to Belladonna, Glonoine, you can go to Calcarea, Phosphoricum, you can go anywhere, you know, Ruta. But this is one of the most kind of hidden treasure that I want to give you here. And Master Norton, you should know that is an authority in ophthalmology and homeopathy. And he writes that he treated many cases of ophthalmic headaches, cases who had excessive myopia, cases which have many ophthalmic issues and then causing headache. He gave onosmodium in a much lower potency with brilliant results. This is just one of the ideas I wanted to give you about the literature in homeopathy that we have. And it's just fascinating how homeopathy can help in cases of this sort. Along with homeopathy, we need to look at lifestyle changes, nutrition, and movement. That's the integrative clinic that we have here in Mumbai. So take benefits of homeopathy wherever you are, whatever issues you have. Definitely homeopathy will help the suffering. Keep in touch, write to us, and thank you.